Each month on Smart Medicine, we give you the chance to ask the expert. This month's topic, deep vein thrombosis, or DVT. Our guest today is general and minimally invasive surgeon, Dr. Lee Morrissey. Dr. Morrissey, thank you so much for joining us.
My pleasure. Glad to be here.
Delighted to have you here on Smart Medicine. What is deep vein thrombosis, or DVT?
As the name indicates, it's a thrombosis or a blood clot in a deep vein, one of the large veins deep inside the body.
What are the causes of this?
Causes have to do with slow or poor circulation or clotting problems. Some people have a tendency to form clots easily, and they have problems. Injury to the vein is another significant problem. Anything that leads to prolonged inactivity or bed rest can bring on a clot like this.
And who's at risk?
People over age 60 are at higher risk, although it can happen at any age. People with a history of DVT are at the highest risk, and they need to take measures to keep from having a reoccurrence. People who are inactive, either due to an injury or surgery or a serious illness, are at risk. Pregnant women, especially during the later stages of pregnancy, can be at risk because of increased pressure and sometimes inactivity as well. Smoking and obesity are common risk factors as well.
So, doctor, what are the symptoms?
Well, the symptoms typically occur in the legs. Sudden swelling of the leg, sudden pain, especially when you're standing still, bluish or reddish discoloration in the leg. If the clot breaks free and travels to the lung, then you can get sudden shortness of breath, rapid faint pulse, and sometimes even fainting or loss of consciousness.
What can be done to treat this disease, and better yet, what can be done to prevent it?
Basically, the treatment is by giving blood thinners or anticoagulants, either by an injection or by a pill form, to thin the blood out. If a person can't take blood thinners for some reason, sometimes we can put a filter in the vena cava, the main vein in the abdomen, to keep blood clots from traveling. Prevention basically deals with the risk factors that we talked about. You can't prevent being over 60, but many of the other risk factors we can do something about. Nowadays, when patients are in the hospital, we frequently give them preventive medication, that is, small doses of blood thinners to lower the risk. We encourage them to get up out of bed and walk and move around. Obviously, smoking and quitting smoking and following a healthy diet and getting exercise are some of the routine situations here.
Well, thank you so much, sir.
Thank you.